Welcome everyone. See everyone signing in. I just want to say good morning and thank you all for coming today. We're going to just let folks start coming into the meeting. Just take a few minutes as people are signing in here. Okay, we'll just wait a couple more minutes and then we'll get started. I just want to thank everyone for taking the time today to come to our AIHM COVID Town Hall. And we will be live streaming this today on Facebook and recording the session. So just so you all know. There's Bruce and Molly coming in from Spain. Welcome. People from all over the country, all over the globe signing in right now. Just really want to welcome everyone from our global community. So we're going to get started. And as people sign in, if you can just say, use the chat to say where you're from. Let us know your name and that you're here. And everyone is automatically muted when you come in. You don't have any video on, just so you know, someone's asking that question. If you have a question, you can put it in the Q&A and we will have a session after our presenters present where we'll have an open Q&A for everyone. So please, Jess Price, one of our AIHM staff, will be helping in the chat room to let people know where to put their questions. Okay. So I just want to start, I'm Tabatha Parker. I'm the Executive Director at the Academy of Integrative Health and Medicine. And the Academy is an interprofessional organization bringing together the global integrative community, really all of us, clinicians, educators, researchers, administrators, organizations, public health practitioners. And the Academy envisions a world where healthcare is about health and available to all, where prevention is our foundation and mechanical fixes are embraced when we need them, where all healthcare providers work collaboratively to heal body, mind, spirit, community, and planet, where sustainability is integrated into our culture, practice, and training. And really, we're working together to establish a new paradigm of health for humanity and the planet. And I just really want to welcome you all again. So many leaders and clinicians from around the world, and for all of the panelists today. I'm going to just give you a real quick recap of our agenda today. We'll have some perspectives from AIHM boards, a few of our AIHM board members. Lucia Thornton will guide us through a centering and remembrance. Dr. Mimi Guarneri will talk about how COVID is impacting our lives. Brad Jacobs is going to be talking about a new NGO that is helping with PPE for our clinicians. And Rachel Abrams will be giving some updates from an integrative clinic. We have some guest organizational updates. We have Tracy Bowen from IHPC, who will be talking about the stimulus packages. Ryan Bradley from NUNM talking about a clinical registry that's been developed. Mike Stroka from the nutrition, the American Nutrition, and talking about nutrition resources, and Iva Lloyd, who will be talking about WHO updates from the World Naturopathic Federation. Mary Hardy, who's a AIHM clinical faculty, will be presenting a short overview of some clinical considerations, and then I'll be giving some updates from AIHM. After that, really, the goal of this meeting is to have an open discussion, really have Q&A with our larger integrative community to find out how we can serve you best, and really hear about, your needs on the ground and how you're facing these challenges today. So we're going to start out with some of our board voices. And I'd like to present and introduce Lucia Thornton, who is our current AIHM board chair. Lucia has over 35 years of nursing, holistic healing, and healthcare. She's worked in clinical, managerial, and administrative positions in various organizations and hospital settings. She developed one of the first inpatient hospice homes and helped create the board certification for holistic nursing. She was the first executive director of the American Holistic Nursing Certification Corporation and the past president of the American Holistic Nurses Association. And I just have the really great pleasure of working with her very closely as our current AIHM board chair. So Lucia, I'm gonna pass it over to you.
Thank you, Tabby. On behalf of the board, I'm sending all of our participants and all of our panelists just a really big welcome and a virtual hug. Before I begin, I'd like to issue a disclaimer. Last night, my internet crashed, so I'm here via a hotspot, so should I disappear, Tabby will take over. This first slide shows the evolution of the Academy. The Academy owes its existence really to many physicians and practitioners that really fought hard and preserved to create a better way to care for people. The AHMA, the American Holistic Medical Association, founded in 1978 by Gladys McGarry, Norm Shealy, and Everett Loomis, really started this movement. And they knew that there was a better way to practice medicine, not to treat the disease, but to treat the person. Not just parts of the person, but the whole person, body, mind, and spirit. And this was the beginning of holism in healthcare. It was not just about curing, it was about healing. And what these pioneers understood, and you can see the how the timeline goes, but what they understood is most important than the timeline. And that was that healing is something that comes from the soul. And it happens when we connect at that deepest level with another person. When we connect heart to heart and soul to soul, healing happens. Healing happens when we meet another anchored in our essence. And what is our essence? Our essence is love. So next slide. The AIHM's history is really an evolution of the ABIHM and the AHMA. And if you go down, today we share those same principles. Next slide. And those principles are the healing power of love, wholeness, the innate healing power that we have inside of ourselves, prevention and treatment, relationship-centered care, individuality, teaching by example, integration of healing systems, optimal health, and learning opportunities. And these actually were started by and several days ago, Bob Anderson passed away. Bob was the founding president of the American Board of Integrative Health and Medicine. And he was also a charter member of the American Holistic Medical Association. Bob helped guide this movement for over 40 years. He served with great humility and compassion, and he led with great wisdom and vision. He was a teacher, a mentor, and a counselor, and actually was the inspiration and force that helped many of our physicians, many of our physicians that went on to become presidents of the organization, gained the knowledge and the courage to practice holistically. He was really the first that began to really put together this body of knowledge and to create a very research-based body became the basis for board certification. But among his biggest accomplishments was that his central message was that love is the greatest healer. And that is the message that we must keep alive in our hearts, in our practice, and within the Academy. So let's just take a moment as a community to send Bob healing energies of love and gratitude for all that he has given us and for all that he has brought into this world. So just a moment, connect with Bob and send him love. Godspeed, Bob. We are here today in the midst of great disruption and uncertainty, a definite sort of crisis. And as you may know, the Chinese character for crisis is composed of two symbols, danger and opportunity. Or how I like to reframe it, probably we can choose between fear or we can choose love. We're at a choice point. So please join me as we center ourselves and create an intention for healing. And I'd like this centering and this brief meditation to be not only an intention, but a remembrance of the type of self-care and healing we need to bring into our own life. So if you'll just take a moment, I invite you to close your eyes and just take in a deep breath. And another. And maybe stretch a little. Now scan your body for any areas of tension, any areas of stress, and breathe deeply into those areas. Breathing in the healing energies of light and love, and breathing out and letting go of any tension you are holding. With each breath, breathing in the light, breathing out the negative, releasing tension, releasing stress. With each in-breath, affirming life and love. With each out-breath, letting go of anxiety and fear. Breathing in life and love. Breathing out anxiety and fear. And take a deep cleansing breath and access that place within you that is of knowingness, love, and compassion. That place that is referent to infinity. That place that is the essence of who you are. That place of love. And from this space of knowingness, love, and compassion, let's set an intention for ourselves. Our intention is to reclaim our role as healers in this world. While acknowledging the fear, uncertainty, and anxiety that surrounds us, we choose to act with love and discernment. We choose to care for ourselves and those around us with great kindness. We invite into our lives those practices that bring us closer to our essence, those practices that nurture our hearts and souls. We bring to ourselves some quiet time, prayer, meditation, time in nature. We choose to nourish our bodies with foods that are whole and provide us with vital energy and optimal nourishment. We commit to healthy and optimal time for sleep and rejuvenation. We bring optimal movement into our lives, creating energy that awakens and heals our body, inviting whatever feels right. Exercise, yoga, dance, hiking. We create nurturing relationships in our lives, welcoming opportunities to demonstrate love, exercise forgiveness, and express gratitude. We affirm life and love. Now bring your consciousness gently back to this space, knowing with complete certainty that you have all the resilience to face times with courage and equanimity, that you are a reflection of the divine, that you are perfect just as you are, that the essence of who you are is love, and that you are here to reclaim your role as healer. Thank you.
Thank you, Lucia. So I'm going to invite Dr. Mimi Guarneri to speak next. Dr. Guarneri is the AIHM founding president and really needs no introduction. She is our founding board president of AIHM, a past president of the American Board of Integrative Holistic Medicine. She's the co-founder and medical director of Guarneri Integrative Health in Pacific Pearl, La Jolla, the co-founder of Scripps Center of Integrative Medicine and served as medical director there for 15 years. She co-founded and is the treasurer of Miraglow Foundation. She's a clinical associate professor at University of California, San Diego, and is quadruple board certified. Dr. Guarneri, thank you for being here today, Mimi. And Mimi's going to just talk to us a little bit about the COVID situation.
Thank you, Tabby, and thank you everyone for being on today. Lucia, that was a beautiful, beautiful way to connect with all that really matters. So thank you for that meditation. I have been watching this and really researching it nonstop. One, to see what I can do for my patients, two, to look at it from a bigger perspective, as you put it, this COVID situation, Tabby. The planet, to me, has been telling us for a long time that we have some major challenges, and we've seen those challenges coming in the form of, things like fires and floods and excess heat. And one of the mandates of the Academy, of course, has been always healing people, planet with purpose. And I think we can't walk away without looking at the connection all of this has to our planet. On a practical level, our Governor Newsom was wonderful in putting our life into Sabbath on March 19th with social distancing and closing of schools and so on. And what that's meant for us over at Pacific Pearl La Jolla is we shifted over to telemedicine very quickly, just having a limited number of patients coming in for IV infusion therapies to be seen when they need to, but doing most of our day-to-day work on a telemedicine platform. We put our not only our patients, but we put our staff into face masks and gloves weeks ago. So I feel very grateful that we've been able to stay on top of keeping people protected. And we have recently been participating in an antibody study. We have drawn over 30 lab tests today, and if anyone's interested, I could speak to that in the Q&A later. what we're learning. On a philosophical level, to me, it's no coincidence that this is Holy Week. And Tabby, you've put together this meeting at such an opportune time, really, because it is a reminder, as Lucia said, that love is greater than fear and love is greater than hate. And there is light over darkness. And that's really the messages of Passover, that's the messages of Easter, and so on. So I have been focusing my patients through video messages to my patients, audio messages to my patients. I've been reaching them in that kind of way, reminding them that more people have recovered from this virus than have died from this virus, reminding them that this has been a huge opportunity to share global resources, particularly in the scientific community, where we have researchers, scientists, medical clinicians all over the world coming together and saying, how can we go forward with therapies? How can we go forward with vaccinations and so on? And the pooling of national resources, and you'll hear a bit more about that from Brad, people really stepping up to the plate, ordinary people doing extraordinary things. And that goes out to everyone right now who are out there listening to this message. Is I know each and every one of you are doing extraordinary things, whether it's taking care of family, taking care of a patient, answering cell phones of patients that have concerns and fears. Because at the end of the day, Pope Francis reminded us that our life is truly measured by the love that we give. And of course, that resonates with Bob's message. And I know people are fearful that we're not going to have vaccinations in time. I personally believe that's going to be fast-tracked, and we can talk about that in the Q&A. We have to do everything that we can do to support our immune system, and that's how I'm teaching my patients. It's really about going to our integrative medicine principles, what supports the immune system, proper sleep, getting out in nature, sunlight and air, doing our mantras and our meditation and chanting and Tai Chi and prayer, whatever works, getting a good night's sleep and eating anti-inflammatory diet. This is how I'm teaching my patients to keep their immune system stabilized. And you'll hear from Mary about nutraceuticals, and I'm using those as well. And I think one of the biggest things we can all do is turn off the TV. Maybe 10 minutes a day is probably enough, and really put our energy into doing things that we know are good for us and good for the planet. So thank you for the opportunity to be here this morning, and I'll be on the whole time, and happy to answer any questions later on.
Thank you, Mimi. And just so you know, for those of you just joining, please put any questions you have. We will take a lot of time about halfway through to start answering questions, but we are going to have all the panelists present first. Okay, so I'd like to introduce next Brad Jacobs, our AIHM immediate past board chair. And Brad did his internal medicine residency and general medicine research fellowship at University of California, San Francisco. He also did training in spine medicine at Kaiser Permanente and 5-element and medical acupuncture training at the San Francisco School of Acupuncture in UCLA. He was the founding medical director and an endowed chair of the UCSF Osher Center for Integrative Medicine, and a senior author of the American College of Physicians Evidence-Based Guide to Complementary and Alternative Medicine. So Brad, I'm going to turn it over to you, and just let me know when you want me to advance the slides. And Brad's going to talk to us about a really amazing organization that he's been a part of forming.
Great, thanks. Hi, everybody. So maybe if you don't mind for a moment, just you could take the slides off for a second,
sure.
so I can chat for just a minute.
Yeah, no problem.
Great. Yeah, so currently I run a medical practice called Blue Light Medicine, which is in San Francisco. and in Marin County. That's where I'm located, and also involved in a telehealth company that's focused on women transitioning through menopause called The Cusp. So it's been an interesting time with this transition to telehealth, where 1% of Medicare patients apparently were using telehealth, and now that's dramatically changed in just the course of a month. I also got involved in this PPE, personal protective equipment initiative, because as many of you probably know, the frontline healthcare workers, including administrative people as well as clinicians, don't have enough. And I think that's what, I'll just spend a few minutes speaking to right now, which is, it sort of happened through one of my patients who had a connection with a gentleman who worked for about 10 years in China, was currently living in Israel, and he was basically smuggling in small packages N95 masks out, because you couldn't do it in large batches, because either it would be caught at customs exiting China, or actually at US customs on import, they would either divert it or take it. So the chaos of what's happening in the politics are pretty sad and incredible. Kaiser, as well as UCSF, where I'm at here, University of California, San Francisco, had huge shipments that were diverted literally by the US customs. So they're trying to get PPE and they can't even get their own PPE because their own government's not allowing it through. So we got pretty angry and frustrated. So a group of us, thanks to the geniuses of the technologists that I was partnering with, we created a 501c3 dedicated to creating an open line exchange for PPE. So we could find suppliers that were willing to donate, or people that purchased them and were hoarding and planning to sell it and then realized they should probably donate it, or people that had the financial means, whether it be one of the founders of this 501c3's daughter donated $10 out of her piggy bank, or maybe it's $100,000 from another donor. And then we'd go and identify people that need the PPE. And so we created an online exchange, and Tabby, maybe you can show the first slide at least, that really allows people to come together. So if you're a health professional, you put your name and logistics on it, and then we vet that you're actually truly a health professional doing that good work and not going to turn around and sell it. And then we've identified and procured the PPE, right now focused primarily on masks, and then arrange that to be mailed to you. So this is our mission. The goals, if this is the sort of website where you can either supply PPE, donate money, or you're requesting PPE. We've had over 200 folks sign up for it. This is our first shipment we gave to the VA of about 6,095 masks that we actually found stateside that were supposed to go to one institution, but they didn't need them anymore. So we quickly grabbed them and brought them to the VA. This shipment of 5,200 N95s was twice as much as this San Francisco VA received from the federal government. That's how dire the situation is, that we could double that shipment with only 5,200 N95s. So is this the last slide, Tabby? Yeah, so if those that want to kick in a few dollars, if you can, feel free. There's a website that's worth seeing called 1.3 Acres that a lot of the COVID-19 statistics is based on. One of the co-founders of this nonprofit is created this 1.3 Acres website that has over 120 million visits to it. So they placed our PPE sort of website nested within what they're trying to do, which is to track data. And right now we're working with the folks that are engineers. We're all volunteer. It's 100% of all the money that comes in goes straight out to buy PPE, which we donate. So it's all transparent. And what we're really trying to do now is figure out who's in most need. So we're able to now, the engineers are figuring out how to model, both predict who's going to be in most need in which areas, and also currently who's in having the most need for the PPE and donate it. So if you're interested, it's called humankindnow.org. Feel free to check it out. I will just tell you a couple things just so you know. If you need PPE, please sign up and tell us your needs. The other thing I just want to let you know is everyone in America is going to receive this package. And maybe if you can pull back that slide again, Tabby, if it's not too complicated for you. So one of my partners, I'm sorry, I meant to me, so I can show them this. So this package. So everyone in the United States of America is going to receive this package. I don't know why Trump hasn't talked about it yet, but the textile companies have come together and formed a consortium because, of course, they're losing a lot of money, and if you, all the people that are purchasing from the textiles company, whether it be Hanes, et cetera, have all shut down their requests. So what they've done now is they're going to build 600. They've manufactured 600 million of these masks that are made out of cotton and that are washable and are made for the public, and then have an antiviral agent impregnated in it as a polymer, and it can be used up to 10 times. So this will be placed like this, and you'll see people walking around this. So this is a package of 5. They're making 600 million of them, and the U.S. Postal Service is distributing to every household in America. So that won't be good for us as healthcare professionals, but for public use. And then there's a whole conversation about the proper use of your PPE, your masks. This is an example of a mask that is not an NIOSH FDA approved N95, and this is called a KN95. You could see there, which is made out of China, and that code there, the GB 2626/2006, means it's approved for industrial use, so for filtering particles and things like that. The primary difference for the most part is splash for liquid, like human liquid. So this would not be good for that. But for most of us that aren't doing procedures, this would do just fine. And these are easier to get than the current NIOSH approved N95s. There's a whole science behind this, and there's a whole bunch of fraudulence going on. So we're doing our best to vet through that. I just wanted to share some of that information with you. If you do have a need for some of this, please feel free to go ahead and register your need on our website. Thanks.
Brad, thank you so much. And we just put out a quick poll just to see on this call, how many of you are clinicians who are in need of PPE? So if you want to just answer the poll, it just takes a second and we can see what that need is. So while that poll's happening, I'm going to share my screen again. Can everyone see that?
Yes.
Okay. All right, and I am going to invite our next board speaker, Dr. Rachel Abrams. And Dr. Abrams received her medical degree from UC San Francisco and a master's degree in holistic health from UC Berkeley. She's board certified in family medicine and integrative medicine. She runs the award-winning clinic, the Santa Cruz Integrative Medicine Clinic, that was voted, and she was voted Best Santa Cruz County Doctor from 2009 to 2017. She's taught more than 50 classes and workshops. She's an author, an expert consultant on holistic health for national magazines, radio, TV, and other places for the last 20 years. And so we're just really blessed to have her today. And she's going to talk a little bit about what it's been like to be running an integrative clinic. So, and just so you all know, with the poll, 31% on this call are clinicians in need of PPE and 70% are not. So just a kind of quick poll there. Rachel, are you able to
I am
unmute?
here.
Okay, great.
There we go.
Great. There we go.
Hi, everybody. I'm actually talking to you from my clinic in Santa Cruz, and I just wanted to give an opportunity for anybody to talk about what it's like to be a holistic practitioner in private practice right now. I am in a clinic with currently 8 practitioners, and we are all still practicing in various ways. We are transitioning quite a bit to telemedicine. So telemedicine can be telephone medicine, but it also can be video medicine. So I'm excited to talk about that. if you all have questions about it. I've been doing telemedicine for years now. I find it remarkably effective and surprisingly interesting from a clinical point of view. It's kind of like doing a home visit. You get to see where people are. You get to pull in their family members to talk to you if needed. And, you know, those things they forget to bring to the office, like their supplements or the medications they're on, they can go get them, put them up to the screen like Brad did, and you could take a look at them. So I've been finding it quite effective. I even do physical exams over telemedicine. So I'm happy to talk about that in any way. You can see you can examine tonsils using a flashlight with people. Lots of things you could do. And I've also been surprised as a holistic practitioner for whom that heart connection is so important, how deeply I've been able to engage with my patients and how at this time when they're all so afraid, what a big difference it can make. So I'm a family practice MD, but I also practice with a naturopathic doctor, a pediatrician, who are all doing telemedicine, a psychologist doing telemedicine, and then a chiropractor who is actually continuing to very carefully see patients in the clinic. Happy to talk about that if you'd like. Our state allows her to do that as a necessary practitioner, and she's doing really beautiful work. And then 2 acupuncturists, one of whom is now doing telemedicine visits because the power of her presence with her clients and her ability to guide herbal decision-making and even do tongue diagnosis over telemedicine and Qigong and energy work and acupressure and ear beads is amazing. So happy to talk about any of that, the practicalities of running the clinic. We have had, as most of you probably have had, with the exception of our psychologist, quite a drop-off in our numbers, which is affecting us economically. I think last week I had a 10% census compared to my usual. But this week, 50%, and that's because of a lot of things we put into motion, which I'm also happy to talk about using social media, reaching out to our patients regularly, educating people about telemedicine. They don't really understand what's possible, and putting a lot of effort into that. And lastly, I just want to echo what Mimi said about this time really being an opportunity for us. I'm doing a Facebook Live weekly on COVID and global warming, and the overlap between what we need to do for global warming and what we need to do for COVID is amazingly, interestingly related. And that I think this is an opening for us to make some of those dramatic, fast changes that are going to be necessary to keep us well. Thank you all for being here. Really a pleasure.
Thank you so much, Rachel. Okay, so I'm now going to invite, we have invited some organizational leaders and we're going to hear from them about some of the things that they are doing in their organizations that we thought was really important for the entire integrative community to hear about and to share those resources. And you know, this is obviously only a few of, there's so many leaders out there and organizations putting together really phenomenal resources. So if you are a leader of an organization or you'd like us to share those resources with the integrative community, just please let me know and send them my way. So our next guests will have Tracy Bowen, who's the Executive Director of the Integrative Health Policy Consortium, Ryan Bradley, a naturopathic physician and the Research Director at NUNM. Iva Lloyd will be speaking. She is the President of the World Naturopathic Federation. And we have some resources that Michael Stroka provided from the American Nutrition Association. So I'm going to introduce first Tracy Bowen. Tracy is the Executive Director at the Integrative Health Policy Consortium. She's an expert in building and managing partner coalitions. She served as the ED of the Allison Ferguson Foundation for many years. Her first early career was as an emergency medical technician in a busy Detroit area trauma center, and she has a lifelong commitment to integrative and holistic health. So Tracy is going to show a little bit of work that IHPC has been doing on all of our behalf as integrative providers and the integrative community. So Tracy.
Thank you, Tabby. This has been so nourishing to sit in on this town hall and just be part of this, because it's really coming from such, you know, the most important angle that you guys are supporting the healthcare providers. My role is very different than IHPC's role is looking at how to deal with the public policy side of this work. I added this quote today. I love this quote right now. It's kind of where we're at. And I'm going to read it for people who can't see it. Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. And it's by Arundhati Roy. She's a novelist from India and a human rights and an environmental activist. She's a very powerful person and is a big voice right now in India. And I think that I've been hearing the word opportunity. My background really is from the environmental community, and from my experience in organizing and being a change maker, is that this is such an opportunity right now. And as Arundi Roy said, right now our frontline soldiers need not guns, bombs, submarines, fighter jets, and nuclear bombs, but masks, gowns, gloves, and I'm going to add, immune support, stress management, and a team approach to health. So all these things that what we really need in this war that we're at. Some people in the federal government are calling it a war, and so we are the soldiers of that war, and this is an opportunity for the integrative health community to really gain a voice and gain value, and to be really engaged with what's happening with public policy moving forward. IHPC its mission is to eliminate barriers to health, and with the COVID stimulus, we've been really focusing on how to increase access for all Americans to integrative health. We have made requests with Stimulus 3 and now Stimulus 4. There's a Congressional Integrative Health and Wellness Caucus that's led by two co-chairs, Congresswoman Chu and Congresswoman Walorski. And they've been very supportive of us and our requests. They're also Congressman Tim Ryan in particular has been really supportive, and we have been reaching out directly to the House and Senate leadership. There's two things that you guys can do in our efforts, and it's really important, is that we are making asks. And we need folks from the integrative community to reach out to your congressperson and to submit a request to support IHPC's stimulus requests. And I think Tabby's going to be sending out an action alert to all of you sometime this week. It's made to be very easy, where you just submit your request. You click on a link that will be in the action alert if you do not know who your congressperson is, and it will give you, based on your zip code, the right person to reach out to with their email address, and you'll submit a letter that we've created. You can modify it and personalize it as much as you want, but that would be very helpful. The more that our congressional leadership hears from the integrative health community, the more they're going to listen. And then second thing you can do is, it would be really of value to us right now to get your stories, to hear from you, quantitative and qualitative information about what you're seeing, what your experience is on the front line. Where are you seeing positive things happening? And also, where are your barriers? Where are your barriers for having access for Americans to your healthcare? So those are big things that we can really get support from by you right now. I can share more in depth if people are interested in hearing what we're asking for. Well, I'll just say really quickly, the key things that we're trying to get in Stimulus 4 is just really direct relief for our providers and our institutions. We've asked for an expansion of HRSA's National Health Service Corps to include integrative health providers. We've asked for an expansion of Medicare coverage through CMS of integrative health providers. We've asked for an expansion of telehealth coverage, and I know that's a big issue. In Stimulus 3, there were some reforms made, but it isn't covering everybody in integrative health. And so we're just really pushing that they need to make the full transition. And we've also asked for research funding, $20 million to NCCIH for immune and respiratory research, as well as $20 million to the Department of Defense's Defense Threat reduction agency, which is really partnering a lot with NCCIH now. So we're looking to try to find ways to beef up our research and our evidence-based documentation for moving forward. With that, I'm going to stop and let you guys ask questions if you do have them. Thanks, Tabby.
Tabby, I'm afraid we can't hear you right now. Is your microphone working?
Tabby may be having some problems with her internet, as I disclosed I was having. Would it be possible for us to move on to the next presenter and then take questions from Tracy afterwards? So I believe the next presenter is Ryan. And Ryan is the Director of Research at the National University of Natural Medicine. He's the assistant professor in the Division of Preventative Medicine at the University of California, San Diego, UCSD. He's the recipient of multiple NIH grants and is just an extraordinary researcher. He's published over 50 peer-reviewed original research articles. And Ryan is going to talk to us about an innovative and creative way he has developed in identifying case studies, I believe. So Ryan, could you please take it away? I think.
Yeah, great. Thank you to Tabby and to AIHM for this opportunity to discuss the traditional complementary and integrative health and medicine COVID-19 support registry. This project was really inspired by a couple of different factors. For those of you that are providers out in the audience, I'm sure that you witnessed decisions being made about your practices every day in terms of the essentiality of the services that you provide, and decisions being made about the non-essentiality and limitations on your practices and whatnot. I think you've all also witnessed the overwhelming emphasis that has occurred with COVID-19 on the acute and severe presentations of COVID, and less so an emphasis on supporting prevention, supporting those with mild to moderate symptoms, and certainly very little discussion about recovery and the use of supportive therapies toward recovery. And so inspired by this, plus a little frustrated by a double standard that has existed in medicine for a very long time, this double standard of an absence of evidence for complementary and integrative health therapeutics, I was really inspired to create a system, a clinical case registry system, in order to try to capture as much information as we possibly can about the contributions of traditional complementary and integrative health and medicine to COVID support. This registry project has had collaborations internationally from the Canadian College of Naturopathic Medicine, the University of Sydney in Australia, the University of Sydney Technology, also from Sydney, Australia, as well as contributions from the World Naturopathic Federation and the Brazilian Consortium for Integrative Health and Medicine. And I'd like to just share a few of the details about the registry. I won't go into a lot of details, but I will talk about some of its elements and also provide you some information on how to access the registry. So next slide, thank you. So this is really the introduction to the registry. It is very, very simple. It's on a research electronic data capture or REDCap backbone. REDCap is very secure, HIPAA compliant, etc. That said, this registry does not protect any personal health information or protected health information, and it has been IRB approved by the IRB at the National University of Natural Medicine for distribution. So we do have all the necessary approvals and securities in place. I would like to point out briefly that we're doing everything we can to capture any and all types of providers. This is not a registry that's specific to any provider type. The registry allows the collection of multiple training backgrounds. And then, of course, the ever so present other button, which is, of course, there are other contributions which we may not have thought of. And so throughout the registry, there are additional opportunities to provide detailed information that may not already be prompted through the default answers. So again, this is not a comprehensive list, but we think that we've captured many of the common provider types and backgrounds that would be contributing to care. Next, please. This is just an example of some of the inputs, and some of the categories of supportive care. This one happens to focus on respiratory health. There are additional branches in here for other therapies, for homeopathy, where we prompt some more details about the remedies that are being chosen. Similarly, more details about breathing exercises and additional essential oils that may be used in supportive health, supporting respiratory health. We also have categories for immune health, anti-inflammatory, pharmaceutical drug management, and then other supportive contributions to mental health, general lifestyle advice, and many, many other categories that are available here for input. There are some critical case details that are captured, including presenting symptoms, as well as testing status. And then, of course, critically important is to capture the outcome of any individual cases. Next, please. Okay, I think this is just a blow up of the provider backgrounds. Next, please. And then again, has been approved by the IRB. This is a global effort. We have the support so far of over 20 international organizations that are helping with the distribution. John Weeks, the editor-in-chief, published an editorial in the Journal of Alternative and Complementary Medicine this last week that includes some additional details as well as the registry links. As mentioned, we do have the support of the Brazilian Academic Consortium for Integrative Medicine, and the registry has recently been translated into both Portuguese as well as into Spanish. And so it is available for distribution globally. And John Weeks asked me this past week what was my goal for success. And I somewhat jokingly, somewhat seriously said that I wanted to see 10,000 case entries. And he pushed back on that a little bit as maybe not being realistic, but I'm going to defend that answer, because we know that there are tens of thousands of complementary integrative health providers and traditional health providers internationally, and each of you touches many, many individual patients with your care. And if all of you as providers entered information from just a single patient that you are supporting through this crisis, then we literally would have tens of thousands of entries into the registry. Briefly, I'd like to comment, one important point is that patients can also enter information about their care. And so while the ideal is for providers to enter those critical case details, if you have motivated patients that are interested in contributing, there are fields that enable identification as patients or proxies of patients to also enter information about their traditional complementary and integrative care that they've received in support of COVID. Real briefly, others have asked how we intend to use this information. Will we share data, etc.? We absolutely will share data. There is a field towards the end of the registry that allows the case provider to enter contact information, etc. This is not about keeping information within particular organizational boundaries or boundaries of individual professions. This is because together we are stronger in this crisis, and the most important thing is to capture the information so that we are in a stronger position to be able to advocate for our contributions. And then, of course, the more detailed data, the finer data, the higher the quality data, these data can also be used towards hypothesis generation in support of future research. So again, thank you to Tabby, and thank you to the AIHM for this opportunity to discuss what I consider a critically important project for complementary integrative health. Thank you.
Can you guys hear me now? Yes, okay, great. So I was trying to speak earlier, my microphone went out. First of all, I want to thank Dr. Bradley. Ryan, this is truly one of the most important initiatives that I have seen. And I really highly encourage every one of you on this call to submit into the registry, to share this widely, because this really does give us the opportunity to bring together what we do in a very unique way. So I really encourage everyone to do that. All of these resources will be on our website, aihm.org/COVID, as well as additional resources over the next few weeks. But please take advantage of this opportunity, and just kudos to the international collaboration, really incredible. So the next person I would like to, and Bri, if you could bring up the slides again. Are you able to share the slides?
The one on me is there, Tabby.
What's that?
The
Oh,
one-
it is there. Okay,
Yeah,
so I'm just not seeing it. Okay, so I would like to now introduce Dr. Iva Lloyd. And Iva is she's a naturopathic physician, and she is the president of the World Naturopathic Federation. She has also been, she had founded Naturopathic Foundation's health clinic in Ontario over a decade ago. She has served as the president of the Canadian Association of Naturopathic Doctors from 2005 until 2008. She is the editor of the Vital Link, which is the journal of the CNDA, and has been the editor since 2004. And she founded ndhealthfacts.org, that's a wiki-based website. And Dr. Lloyd's going to speak to us today about some of the work that the WNF has been doing with the WHO.
Thanks, Tabby.
Yeah.
Thanks for inviting me. Okay, the World Naturopathic Federation has been working with the World Health Organization for the past 5-6 years in getting official collaboration status. We had the privilege of attending a meeting that we were invited to last month, March 30th, with 11 NGOs looking at the role of traditional complementary medicine with respect to controlling COVID. And there was a number of them were represented organizations from Asia and stuff like that, but it was a very good representation from, I think there were representatives from 9 different countries. And what came out of that was the WHO echoing what they have said to the WNF repeatedly. If you want to have serious conversations, you have to do so with research. And the only research anybody is listening to right now is not tell me everything you know about vitamin D, but it needs to be very narrow with respect to what is any substance, what role can it play with respect to immune system and viruses similar to COVID-19, such as SARS and MERS. So what we are putting together is a number of rapid reviews, looking at currently the ones we have planned for are NAC, vitamin C, vitamin D, and zinc, elderberry, echinacea, glycyrrhiza, and ivy leaf. And then looking at some of the other research that has been done, such as the micronutrients required for immune health and blood sugar. So we recognize right now that a lot of what we're doing is planting the seeds, getting the research there so that when we are asked to come to the table and when they are looking for these answers, we have it. Part of the conversations that I've had with the WHO as to part of the challenge right now is that there is such a flood of information that is out there that is maybe relevant, but it's not research-based, and that's hurting us. That's hurting the naturopathic profession, that's hurting the natural medicine profession in getting our medicine or getting our message out there, because it's not based on research. It's based on practice, it's based on what we believe, it's based on 1 or 2 studies, but it has to be done in a way that we have the respect that we can do that. The other thing that the World Naturopathic Federation is doing is communicating more our approach to COVID and really helping to communicate that idea that the focus is really about susceptibility and treating the whole person and looking at, for example, the nutrients, as most of you will know, the nutrients that are responsible for handling immune threats like this are also the ones that are required to handle environmental threats like Wi-Fi. So it's that whole person perspective, and trying to change the focus away from the virus back to the person, and educating them about self-care and self-responsibility, and getting them, because as we all know, fear is a big factor right now. And when people understand that there is a logic to who's affected and who's not. So it's changing the conversation and looking at what we can do to educate the public on lifestyle and on some rationale that is a conversation other than just the virus. Because of restrictions from a policy point of view and regulations around the world, most naturopathic doctors or most naturopaths, they're limited in the treatment and saying they can treat it. So a lot of the focus is on health promotion. But one of the other things that we want to keep in mind is there will need to be a big focus on recovery. And we're putting a lot of, the next step, which is to put some research in place from a recovery point of view, because the people who are getting moderate or severe symptoms with COVID, it is scarring the lung, it is changing the physiology of the lung, and we need to focus on that. So the WNF is really looking at being part of that conversation and recognizing we need to do that through research. So that's what we're doing.
Great, thank you so much, Iva.
You're welcome.
So Michael was not able to join us today, but I just wanted to let you all know that the American Nutrition Association, if you could advance by, they have put together an incredible resources on their site for both professionals, public, and they have a rapid resource task force. So if you're interested in nutrition specific information, I would highly recommend going to the American Nutrition Association site. And again, you can find a link on our website as well. Bri, can you move it forward? So next, I'm really just very excited to present Mary Hardy. Mary is an AIHM faculty, advance please, here within our fellowship, but she is also just an incredible physician. She has started in 1998. She founded the Integrative Medicine Clinic at Cedars-Sinai in Los Angeles. She has extensive experience in evaluating evidence and efficacy and safety for CAM. She served on and chaired several United States Pharmacopoeia expert committees. She is the recent past medical director of the Simsman UCLA Center for Integrative Oncology, the past co-director of Integrative Medicine Health and Wellness Program of the Venice Family Clinic, the largest United States free clinic. And her current research interests include reviewing evidence for the safety and efficacy of natural therapies. And she's just going to run through a bunch of slides really quickly. We're going to be doing a full 90-minute webinar with Dr. Hardy, specifically on this information. She has a larger presentation, but we thought it was important to have some of the clinical resources available, and we're really excited to have Dr. Hardy present. So thank you, Mary.
Okay, thank you very much. I think I unmuted myself. You guys can hear me correct, right? Great. Okay, so I put up some really authoritative resources for you. This is much more in the conventional side, but there they are so you can know what's going on there. Brian, can you advance for me, please? And the first thing I think it's important to say is that right now there is no known cure for COVID-19, and we have to be meticulous when we discuss our interventions, that as of now, we don't have proof of cure for any of our interventions. We can certainly, with Ryan's excellent registry, over time develop easily, I think, evidence for symptom mitigation, resiliency, resistance, etc. But I can tell you right now, the FTC in particular and the FDA as well, are highly, highly focused on being punitive about anyone who is touting a cure for HIV, especially from the natural community. Next, please. I think that what we can do for this as integrative medicine practitioners, it's right in our wheelhouse. All of the failures of the Western diet and Western medicine that are listed on this slide come down to compromised immune function, and we know how to do all of this better than almost any other practitioners in the Western model. Next slide, please. So this should not be unfamiliar for you. There is a bunch of data about how minerals, vitamins, etc., impact immune competency. And I think one of the best things we can do for our patients right now is review diet, supplement history, etc., and confirm that they have all the micronutrients that they need to have a competent, intact immune response system. Next, please. One thing I've been very excited about is digging into the vitamin C data. So you're seeing the absolute tippy tip highlights of my last big evidence dig. And there was tremendously interesting information, not specifically devoted to COVID, but this is looking at patients who are in the ICU for other conditions, including some that have ARDS, which is the end state disease of COVID after the cytokine storm happens and creates damage in the lungs. In any case, both intravenous at about 50 grams a day, IV vitamin C, and even oral vitamin C at levels of 1 to 3 grams per day showed benefit for decreasing time in the ICU, decreasing time on a ventilator, and decreasing time in the hospital, increasing discharge. So this is a dead simple thing that I think all of us who have access to patients should be thinking about doing. Next, please. And I'll review all this in more detail on the longer program. Next, Brian, please. And here's the outcomes. So both IV and PO, decreased length of stay, etc. So vitamin D, there's been a lot of controversy about this, and I'm happy to answer questions. But vitamin D itself is at an adequate level, is critical for a competent immune system. Next, please. Both in the innate and the adaptive immune system, little cartoon showing you how. One of my fellows has written to me, and we're currently discussing, he's in Tennessee, and he's been testing his COVID patients and finding many of them, if not most of them, have vitamin D levels under 30 nanograms per ml. So Ryan, I would like you to include that as one of your fields. Next, please. Zinc, again, is something that's had a lot of focus. Zinc is interesting. It has a biphasic response. At the deficiency level, it's really pretty clear that you need it for competent thymus, TH1, TH2 balance, B and T cells. If you have the right amount, you're in homeostasis. But at excess, which of course, we're Americans, if 1 is good, 10 is better, you will actually suppress immune function. That's an important message to send now. Next, please. One class of herbal medicines that are not well understood in the Western system, and in fact, we don't even have this therapeutic model, is this heterostatic effect of adaptogens. These are lovely, lovely plants. They tend to moderate the stress response in terms of decreasing excess stress and then bringing up the function of patients who have entered into the depleted dysfunctional part of a stress response. And this adaptation is critical. These plants by definition are non-toxic and are intended to be used therapeutically for months without harm. So I think there's a very interesting discussion to be had there. Next, Brian, please. And so here are four very well-known adaptogens. Each are a little bit different. Each can be tailored for the particular person in front of you and their additional symptoms, as well as their potential for preventative use more than anything else. But each of them have a little bit different responses. For example, rhodiola is particularly good if the patient presents with also anxiety or depression, just as a quick example. But we're going to discuss all of these in much more detail. Next, please. Medicinal mushrooms have also gotten some controversy around them, but it's very, very clear that there's a whole lot of medicinal mushrooms listed on the left side of the slide, and a huge body of literature going back into animal and studies, but there's also a human tranche of data that needs to be looked at as general supporters of immune system effect. Next, please. Melatonin, I think some of you already know about this. It's been used a lot in cancer patients at very high doses, but it's also clear that melatonin, potentially through regulation of the sleep-wake cycle, etc., enters into regulatory systems in the hypothalamus that then end up coming downstream to affect T cells, killer cells, etc., activated macrophages, etc., and help produce or moderate the production of inflammatory cytokines. Next, please. There's also from China a huge interest and a lot of interesting data. And this data is literally developing day by day. Every day I go back into the NIH PubMed, there's a special COVID section, and I review this. I'm seeing new data coming out from China about how they use traditional Chinese medicine to support COVID virus patients with good results. So those of you who have an expertise in traditional Chinese medicine, here's the categories that were used in SARS and that were also used in COVID-19. Next, please. And this is a systematic review published from the SARS epidemic several years ago, published recently, but from the SARS epidemic a couple of years ago, showing that ancillary support with herbal formulas really did show a survival benefit and help perhaps with prevention. Next, please. This is a listing by frequency, just a crude reporting of what people used and what herbs they used in their formulas. And not surprisingly, astragalus, huang qi, and glycyrrhiza, which is the guansao, which is the licorice, that the Chinese licorice, were perhaps the two most common herbs used. Could inform us as we go forward. Next, please. So I'm not going to go into this in great deal. You can certainly ask me questions in the chat, but I've seen some of these commercials where people, including some religious pastors, have been touting the effect of silver as a killer for colloidal silver for coronavirus. No, there's been discussions about the possibility of elderberry and echinacea leading to an unhealthy response, some discussion about mushrooms, and there's been a whole lot of discussion about vitamin D. And now there's actually data being published looking at humans and vitamin D that I think is quite useful. ACE receptors, which is how the virus attaches to cells to infect them, has gotten some attention as well. So next, please. So here's just a quick look at what I'm generally recommending. Here's all the usual things that you guys know about. Get hydrated, adequate rest, exercise moderately. It's important to note that strenuous exercise is actually an immune depressant. So be careful. Don't be running your marathons on your porch like this guy in India did. Here's the major components of an immune supportive diet and stress management. Next, please. In terms of supplements, the things that I have said as a gross simplification, if you have the ability to check levels, try to get everybody to 50 nanograms per ml. I consider that to be minimally sufficient. Western medicine will probably say you're okay at 30 nanograms, but I doubt that you are optimal. And if you don't have the ability to do that, 1,000 to 2,000 international units per day for virtually anybody will be helpful and will not hit the tolerable upper limit, which is 6,000 to 10,000, depending on which expert you look at. And it's likely not to push people over 100 nanograms per ml, a level with which there has been some adverse effect reported. Vitamin C, I think everybody should be on 1 to 3 grams a day. If you can tolerate it from a GI point of view. I'm not sure that huge doses orally will provide additional benefit, as there is a limit on absorption. The mechanism of action for vitamin C orally is probably an antioxidant level, and the mechanism of action for vitamin C intravenously probably works by producing hydrogen peroxide, which is maybe virucidal. Zinc, probably 15 to 30 milligrams a day. Consider the lozenges. That's probably the best way to apply zinc if you can find them. It's hard to find them now. And zinc is critical in the mitigation of taste. So the fact that that's one of the early signs potentially of coronavirus, and we know zinc is important, is interesting to me. I think adaptogens and medicinal mushrooms should be considered where appropriate individually. So Tabby, that's, I think, everything I have for this today. But please, I really invite you to join me. If you have other questions, put them in the chat. I will answer them in detail when we have our 90-minute talk. And it's just a great to be able to talk to all of you and to say that we are powered by our heart and our mind and our hand to be very useful in this epidemic. And don't forget that.
Thank you so much, Mary.
You're welcome.
So I'm going to go very quickly through this so that we can have a little bit of time for Q&A, although lots of questions have been asked and answered. So thank you so much to all the panelists who have been doing that. So very quickly, I want to talk a little bit about what the Academy is doing. Next, Bri. And you know, over the last year, we have started over 100 international chapters, and this is just one picture of where some of those groups are. So one of our biggest missions and visions is really bringing us all together as an integrative community so we can share and really become, you know, more active together. Next. So our membership is critical to what we've been doing, and next. And so is our education. We have the most diverse 2-year integrative health and medicine fellowship, one of the largest global online integrative health libraries with CME and webinars, and the longest running evidence-based conference now called People, Planet, Purpose, which is really the legacy of the conferences started in the 70s by HMA. Next. So just very quickly, we as an integrative community and as leaders on the AIHM board have really taken a lot of thought in this, and we have decided that we will be transitioning all of our programming to online only through the end of 2020 at least. So that means the annual conference in September, we will be transitioning to a virtual conference. All of our retreats for the fellowship will become virtual. Our graduation for fellowship will be virtual this year, as well as all of our clinical immersions for the fellowship program. And these decisions, you know, we have really some of the best experts in integrative health and medicine at our disposal. And we really do feel that for the safety of the community, and for the needs, you know, we have so many of our clinicians right now are on the front lines, they're working extra hours, they're in hospital systems, that this is the best thing for all of us. We'll be transitioning all of our chapter meetings to online meetings, and we've had, you know, the last month there were 30 chapter meetings all over the country, all over the globe. So all of those are being transitioned. We are providing free CME in our online platform. We'll be offering 2 weekly wellness webinars. We'll have a Monday morning webinar that will be short and just kind of start us all together, whether it's a short meditation or some way to visualize all of us. We really feel that keeping positive and staying together as a community is really critical right now. And then we'll be doing Friday lunch webinars where faculty like Mary will be doing longer presentations on specific topics. We'll continue to do the town halls and really bring leadership from all integrative professions and organizations together. And we'll be creating a repository of all of the different integrative health organizations so that we can really have a place that we can go for all of that. And then our clinical group, COVID group for members in our AIHM online platform, Mary Hardy will be working to kind of have like a listserv for more clinical questions. And then really asking this community what you need. So I'm going to move to just opening it up to Q&A. If any of you want to ask a question, you can raise your hand or you can post your question in the Q&A section.
There's a really good request for Mimi to speak about ACE inhibitors and COVID. The question involving the induction of ACE receptors by ACE inhibitors, and does that increase risk of infection? That's from Cheryl Cuozo.
Mimi, would you be able to answer that question? Hold on. You have to unmute your computer.
Okay.
There you go. We can hear you now.
Okay, great question. There's been a lot of attention because we know that the COVID-19 virus has a mushroom-like plug that sits on the AT2 receptor, remembering that we have AT1 and AT2 receptors. People got nervous thinking that the receptors were a conduit for the virus to get into cells, and therefore ACE inhibitors and be a problem, because if you take an ACE or an ARB, the theoretical concern that you upregulate the AT2 receptor. Every cardiovascular group, an organization, basically right now has come out verifying that that's theoretical and hypothetical. It's not necessarily the story. So we have not stopped our ACE ARBs. You can go to the European Council on Cardiology, JAMA, New England Journal of Medicine just published a rebuttal to this. Everyone is staying on ACEs and ARBs to the point where we're starting to think that they may be protective. Why? Because one, they block the receptor. ARBs may even be better than ACE because of the specifics for the AT2 versus AT1 issue. Now, University of Minnesota is actually studying this. They're giving people ARBs to see if they can be protective. So it was an early concern, much like what Mary said, vitamin D concern, elderberry is a concern, lots of things floating around right now, but we are recommending not stopping the ACEs and the ARBs. I do want to add to something Mary mentioned about the rhodiola. There's a body of evidence right now that the lung damage being caused by COVID-19 may actually be more related to PEEP from the mechanical ventilators. There's a concern that many of these patients are behaving more like someone who has high altitude lung disease, high altitude pulmonary edema. It's that research coming out that has moved into rhodiola as part of my primary protocol, because we use rhodiola for altitude sickness. So we don't know everything about this virus yet, but that's where we are at based on the data that I've been following.
Mimi, this is Mary again. I'm just going to comment for one more second about your idea about altitude sickness. And having traveled to Peru a bunch of times to the Amazon, I also went several times to 14,000 feet, which was horrible for me. And the first time I got the worst altitude sickness I ever saw. I went back and looked at the literature, there are a number of studies looking at ginkgo, which we know it's a high flavonoid plant. We know it stabilizes microvasculature, and it's also been used successfully for high altitude accommodation, and it worked great for me. So it's something else for you to think about, and I can send you those papers if you need them.
Terrific. Thank you.
Great. So we're about time, and I would like just to ask people to continue to send us any of your questions. We will be putting together another AIHM Town Hall where we can continue this type of Q&A and be a resource for everyone here. Next slide. So just what's next? Like I said, we'll be continuing the Town Hall series. We'll continue with expert faculty webinars and free resources. Please, as clinicians, let us know what you'd really like from us, and we can put that together. We'll be creating the repository and connecting and building our local chapters and staying connected. Next. Truly, this is an opportunity like no other for us to build our integrative community and build those links stronger than we ever have. And have, as many of you have said on this webinar today, we are truly stronger together. Next. So I just want to thank everyone for being here. I want to thank all of the leadership. I really want to thank all of the clinicians who are out there on the front lines, putting your own lives at risk and really taking care of our community right now globally. We are so grateful for all of you, and we look forward to seeing you soon. Next. All of this recording will be available on our YouTube channel and on our website. And stay connected with us. Let us know what you need, and be safe out there. Thanks again.